After a very long cold winter, I often experience a boost in my mood as the weather warms up and spring arrives, but that isn't always the case for everyone, is it?
Well, living in a northern climate, our winters are long and cold, and yeah, many of us look forward to spring when it's warmer and sunnier days. But it's also a time for many to do a little bit of spring cleaning, and so in the case of our mental health, it's a good time to just do a check-in and maybe make that phone call that you've been avoiding making.
That phone call is for some help, make a doctor's appointment, or what do you mean when you say doing a mental health spring check-in?
Yeah, spring cleaning is a great time to, clean your house and, look after, all of the material things in your life. But I think sometimes we forget that it's also a great time, to do a check-in, with your mental health. So, it might be a time, maybe you make that call to an organization like Anxiety Disorders Association of Manitoba, or, call your doctor, maybe talk to a friend, a loved one, someone who's trusted, and if something's been bothering you, it's a good time to do that spring cleaning.
Are there certain tasks or activities that we can do ourselves to help clear and refresh our minds, as the seasons change?
Yeah, well, certainly spring, it's a great time to get outside. There's a direct correlation between spending time in nature and reduced anxiety rates. So I know in the case of, watching some rather stressful hockey games, sometimes it's nice to go for a walk and stretch out the legs and, exert some physical energy to maybe take some of that mental stress off of your back. So certainly, being active. Less screen time is also really important, because there's also a direct correlation between screen time and increased anxiety. So, the advantage, of course, to spring is that we can be outside and we can be more active, and you can put away the phone for a little while and take care of your mental and physical health.
I know your organization offers all kinds of programs that can, offer some added support. Share a bit of those details with us.
Yeah, so Anxiety Disorders Association of Manitoba, it's a small charity founded in 1986 by a great man named Dr. John Walker, who was a clinical psychologist who was delivering a program for a patient who had an anxiety disorder. Got to the end of the program, the patient said to Dr. Walker, "Look, I think I can deliver this program better than you." And kind of voila, out of that, the Anxiety Disorders Association of Manitoba was born. And so we offer a clinical model based on cognitive behavioral therapy, but it's delivered by people who live with anxiety and are managing anxiety and with lived experience. And so it's called peer support, and that's what we do. And so if someone's wanting to, get some help, you don't have to have a diagnosis of an anxiety disorder to get service with us. And we also work with a number of other organizations out there, and rely on some tried and true practices in terms of how to reduce anxiety. And certainly, we do live in some really anxious times, and we just encourage people to, take that first step and reach out while they're doing their spring cleaning. Don't hesitate to, give us a call maybe.
And you can find more information online. That website was up on your screen. Scott, thanks so much for your time. It was great speaking with you.
Really great, and just appreciate the opportunity to be on air, and go Jets go. There's going to be a lot of stress for us over the next little while, but feeling really good. Make sure you get out there, go for a walk, put away the phone, and be present, and it's we're really lucky to live where we do, and things are really good. There'll be sunnier days ahead for those of you who are struggling. Reach out. You're not alone. 1 in 4 will manage an anxiety disorder in the course of their lifetime.
Such a great message. Thanks again, Scott.
Thank you.